In the state of Ohio, I was on the Judiciary Committee. And as a committee, we asked a lot of the insurance companies, we asked the plaintiffs' lawyers, we asked the trial attorneys to bring us those cases. Bring us those outrageous cases. Bring us those outrageous settlements. You know, redact all the information. Redact all the privacy stuff. Bring it to us. The fact is that it's not nearly as prevalent as people believe it to be. That it's great rhetoric, don't get me wrong, it's great rhetoric that gets people going. But the outrageous settlements simply aren't out there. At least not to the extent people believe that they are. Part of the challenge we faced in the state of Ohio was that we had very few providers when it came to insurance, malpractice insurance for physicians. And those providers saw some serious losses. When they saw losses in their portfolios, they increased the premiums on many physicians. That was the reality of what we were dealing with in the state of Ohio. Now, that's not to say that there's not room for reform. For instance, if you're an OB-GYN and you are looking over your shoulder because a child that you delivered can sue you after they turn an age of 18, you know, I think that's fundamentally unfair to that physician, and I think a lot of people do. But that's the way the current system is structured. Now it changes from state to state, and we passed tort reform in the state of Ohio, at least when it comes to medical malpractice. We didn't see a dramatic increase or a dramatic decline in rates. So not only do you have tort reform, but the bigger problem around tort reform is the practice of defensive medicine. That is, if someone is afraid of being sued, they will prescribe everything. They will give you every test out there in order to avoid being sued. I think we have to get away from that. And part of what we're trying to do is say, look, if the physician follows well-established practices in the treatment of the individual, they can't then get sued outside of it. So there is a way to try to deal with defensive medicine, and we've got several physicians in our caucus who still practice, who are very concerned about, you know, the practice of defensive medicine and trying to drive down costs by reducing defensive medicine. So that's part of what we're trying to do.
Mr. Driehaus.
Please explain the difference in medicine between price and cost. The difference between price and cost, like most markets, is administrative overhead and profit. So, you know, the cost is the cost of providing a service. Included in that cost usually is administrative overhead, and so that's the difference. With the U.S. being in 3 countries in the world regarding mortality and what are the unintended consequences from the House bill? I'm concerned about the unintended consequences. You know, look, part of being a legislator is you read what's in front of you, and you hope that you're getting it right in terms of what's going to happen. Let's talk about cars. Cash for minors. You know, the idea was that program would last for 60 days, and then it would end. It went 4 days, and the $1 billion that was allocated toward expired. So, you know, there are unintended consequences with most bills that we pass. The challenge for the legislature is to try to, in my legislative experience, in both Democrats and Republicans, and this isn't unique to Democrats or Republicans, we often vote on policy. We think that what we're doing is doing the right thing when it comes to public policy. And then you find out a year down the road or 2 years down the road that, you know what, the way we structured that doesn't quite work, that it needs to be fixed. And so oftentimes you will see legislation come back, and it's called cleanup legislation. You see it in every session of the state legislature, and certainly this session of Congress. You see it every time. Look, folks, we are far from perfect. Social Security is adjusted. We continue to address these programs over and over. Yes, ma'am.
Sir, you said the intent of this bill was the intent of the bill was not for a single payer. In 2003, when Barack Obama was running for senator, he said that was his goal, was single payer. In 2007, when he was running for president, he actually said he was still for that. It would take about 10 years to phase out driver insurance. Yes. And to the American people, I recently heard him say this will not cost one dime, not add one dime to the debt. Why have you heard, the American people here have heard that if it does add more than one dime on the national debt, you will scrap it if it should ever get passed?
Yeah. We are committed to that, to this being paid for. Now, let me help you. There were a lot of policies in the last 8 years that weren't paid for. There were, you know, like, so when we talk about fiscal responsibility and paying for things, this is paid for. Now, that's part of my concern as well. Part of my concern over the bill, quite frankly, is the way in which it's being paid for. Right now, at least in the introduced version of the bill, there was a surcharge on businesses with payrolls over $250,000. That concerns me a lot because I don't want to be putting burdens on small businesses, the same small businesses that are out there creating jobs. That same surcharge has been adjusted just on Friday in the amended version through Energy and Commerce to $500,000. I'm trying to reach out to, look folks, I'm just telling you what they did. And I'm in the process right now. I just spoke to several small businesses today about how that impacts their bottom line and what they're going to do to try to address that, how that would hurt them. Because I'm very aware that this is the last thing in the world I want to be doing is hurting small businesses that are creating jobs. And so if this thing is to be paid for, I want to make sure, first of all, and many of us have argued for a trigger mechanism, because we talk about all the cost savings that are in the system. And if there are really that many cost savings, and we can achieve a lot of what we're trying to achieve through savings, then let's not move forward with any increase at all, but let's just achieve it through the savings, and then until a trigger hits. And at that time, we can decide if we want to move forward. So that discussion is ongoing amongst the Blue Dogs, amongst a lot of moderate Democrats, and we are trying to, you know, figure out what might work best. Again, let me help you. There is not consensus on this legislation. There are still a lot of people talking about different aspects of the legislation and trying to get it. So, you know, that's what we're doing. Yes, ma'am.
Microphone. I'm concerned about everything that's been mentioned in the personal property. The thing that concerns me the most is that this bill will not support abortion. That is, we do not pay for abortion. That feel differently. I'll tell you where I am opposed to public funds going to abortion. It's called the Hyde Amendment right now, and under both, it's predominantly Medicaid, but also Medicare. That doesn't please a lot of my Democratic friends, I'll tell you. But I am opposed to public funds being used for abortion. I wrote to the President of the Mexico City Hall. I did vote against the rule, if you pay attention, because we didn't include that. I didn't vote against the foreign ops bill because it was far larger than that. And the amendment, you know, it's kind of hard to vote against